Hello, I am Hannah Percy, and I'm going to present Sue and Bob as an example as to why there's a need for financial support in colorectal cancer screening. Due to their circumstances, I have created a federally funded service to help those in need of financial assistance for colorectal cancer screening in southeastern Idaho. Sue is an average-risk 50-year-old woman getting a referral to her physician for a colonoscopy. She has met the guidelines for colorectal cancer preventative screening and has been informed by her insurance that her preventative screening will be covered at 100%. She has been educated about colorectal cancer and how colonoscopies and removal of adenomas can prevent future cancer. Because she was informed testing is covered, she decided to proceed with the recommended cancer screening test. During Sue's colonoscopy, a polyp was found, removed, and sent to pathology. Pathology revealed this polyp as an adenoma or cancerous-forming polyp. She's thankful that she had this screening and that her polyp was removed. However, in about a month, Sue received a bill for a colonoscopy. She was uninformed that if a therapeutic intervention such as polyp removal was performed, the colonoscopy would no longer be covered, and now she is faced with a bill she cannot pay. On the other hand, we have Bob. Bob heard that he is due for a colonoscopy. He has scheduled his colonoscopy and has found out that if there is a chance that he will have to pay out-of-pocket costs for his colonoscopy if any therapeutic intervention or polyp is removed. Due to this fear of out-of-pocket expense, Bob has canceled his colonoscopy and will not proceed with colorectal cancer screening. Being the second deadliest cause of cancer-related deaths, colorectal cancer needs to be addressed. It is mostly found in those aged 50 years and older. However, studies have shown the age of colorectal cancer diagnosis to be becoming younger. Idaho is less than 60% adherence, and the Healthy People 2020 goal is 70.5%. Colorectal cancer is prevented through screenings when cancerous polyps are removed. Colonoscopies are the most effective screening test because they can prevent cancer through the removal of polyps when performed within the recommended screening guideline. Due to the poor adherence rate, it's estimated that 95,520 colorectal cancer cases and 39,910 rectal cancer cases will be diagnosed in 2017. This results in approximately 50,260 deaths. It's alarming that 30 to 40% of these colorectal cancer deaths and incidents could be prevented. The U.S. spends over $14 billion in colorectal cancer treatment costs each year. Cost is the #1 patient barrier to colonoscopy adherence. So it's vital to eliminate these barriers to increase screening and save lives and healthcare expense. Medicare and Medicaid have included colorectal cancer screening as one of their cancer preventative screening tests to be fully covered. However, if a therapeutic intervention is done, such as polyp removal, out-of-pocket costs will apply. Studies have shown that even patients who are covered under health care insurance, the barrier of out-of-pocket expense still prevents them from undergoing preventative screening tests. It is vital to initiate a program that can hinder the cost barrier and increase colorectal cancer screening adherence and prevention. With the help of private donations and grants, the Fear No More project will provide those who meet the criteria based on a salary scale to have monetary assistance with the coverage of pathology and colonoscopy costs that are not paid through by insurance. Our mission statement is to provide financial assistance for colorectal cancer screenings by assisting with unexpected costs to promote colorectal cancer prevention in the underserved population of southeastern Idaho. Our slogan is Fear No More and Get Scoped. Our values are included to promote healthy lives. We are committed to the future community health, eliminating barriers for the underserved population. We value the preventative care and affordable quality care. This project will take place at the existing Southeastern Idaho Gastroenterology Endoscopy Center, and financial assistance will be based on a sliding scale based on the total house income. With the total house income increase, the coverage for pay, the percentage of pay will decrease. The goal is to provide assistance that will encourage those with no insurance or those who cannot afford added expenses charged from colonoscopies that are not covered, such as polyp removal or tissue biopsies. The population that this project services is those who meet the Centers for Disease Control and Prevention guidelines for colorectal cancer. These guidelines recommend those at age 50 years and older to get screened for colorectal cancer and those who are high risk to get screened even earlier. According to the United States Preventive Service Task Force, this means that a colonoscopy is considered a significant benefit to people aged 50 to 75 years old who are at an average risk for colorectal cancer screening. This service will help those who are subject to screening to not have to worry about out-of-pocket costs, increasing their likelihood to get screened. Not only will this save lives, it will also decrease the healthcare costs and expense in the United States. With the U.S. spending over $14 billion a year in colorectal cancer treatment costs, eliminating these cost barriers to colorectal cancer screening will increase the adherence and also decrease incidence of colorectal cancer mortality. An estimated 10,000 lives could be saved each year in the United States, with appropriate screening saving approximately $11,900 per life saved in healthcare expenses. With the help of federally funded grants, patients in southeastern Idaho will no longer have to fear the barrier of out-of-pocket costs. Eliminating cost barriers will increase the prevalence of patient screenings and decrease colorectal cancer incidence, leading to saved lives. So fear no more and get scoped.